Hi, I'm Darlenis, and I'll be your nurse for today. How are you?
Good.
Can you please state your name and date of birth for me?
Arlene Guyon, August 2005.
Okay, thank you. Are you having any pain?
No.
Do you have any allergies?
No.
Okay, so I'm here for a full assessment. I'll assess your head all the way down to your neck today. So I'll start off by observing that your head it looks symmetric on both sides. Your eyebrows are also symmetric. Your eyes as well. They're at normal eye level, aligning with the ear here, so that's good. I don't see any visible bumps, lumps, or lesions on your nose, and it also looks symmetrical as well. Your lips also look symmetrical. So I'll just do hand hygiene and put some gloves on so we can start with the assessment. Okay, so I'm gonna start off by feeling your head for any lumps, bumps, or protrusions. Is that okay with you if I feel your head?
Yeah.
Okay, so I'll just start doing that. Okay, so I don't feel any bumps, lumps, or any protrusions. I'm also inspecting to see if she has any irritation on her scalp or pests, and I don't see any, so that's good. No lesions either. Okay, good. Now I'm going to go down to your temporal artery. Is that okay with you?
Yeah.
I'm just gonna feel for your artery, your pulse right here. Okay, I feel it. I'm gonna go down to your parotid gland now and feel for any tenderness or enlargements. I don't feel any tenderness or enlargements, so that's good. I'm gonna go down to your temporomandibular joint. Can you please open your mouth and close for me? Open, close, open, close. Okay, thank you. I didn't feel any clicking, no stiffness, no crevitations either. So that's good. So now I'm going to feel your sinuses. If you feel any pressure or pain, tell me. So I'm just going to feel up here first. Do you feel any pain or pressure?
No.
Okay, now I'm going down here. Any pain or pressure?
No.
Okay, I don't feel any tenderness either. So that's good. So now I'm going to assess your lymph nodes. I'm going to start off by feeling for your preauricular lymph node, to your posterior auricular lymph nodes, to your occipital, to your jugulobigastric, to your submandibular and submental, to your superficial cervical, to your posterior cervical, to your deep cervical chain, to your supraclavicular. Okay, so I didn't feel any enlargements or bumps, lumps, any tenderness anywhere, so that's good. Now I'm going to assess your range of motion in your neck. So I'm going to need you to, without moving your shoulders, try to touch one side of your shoulder with your head. Go all the way. Okay. Did it hurt when you did that?
No.
Okay. Other side. Again. Did it hurt when you did that?
No.
Okay, thank you. So now I'm going to need you to sit up a little bit to the front, right there. And I need you to rotate your neck all the way. Did it hurt when you did that?
No.
Did you feel any stiffness?
No.
Okay, so I didn't hear any clicking when she did that. There's no tenderness in the neck. I would say it's full range of motion. And now I'm going to assess your thyroid, so I'm just going to stand in back of you. You just stay right there. I'm going to feel a little bit here in your throat. Okay, so I'm just going to press down on one side a little bit. And when I tell you to swallow, swallow for me, please. Can you swallow? Okay, good. Other side, can you swallow? Okay, thank you. I'm just feeling to see if there's any lumps, enlargements, nodules, and I don't feel any, so that's good. I didn't feel any enlargements either, so her thyroid is not enlarged. Can you smile for me? Okay, your face looks symmetric when you do that. Also, as she spoke to me, I noticed that she didn't have any involuntary facial movements, so that's good. I also see that your sclera is white, it's not yellow. Your eyeballs are also symmetrical. Your iris is brown, light brown, and your pupils look brown and symmetrical. Okay, so now I'm going to assess cranial nerves 3, 4, and 6. So I'm just gonna ask you to follow my finger. Okay, that's good. I didn't see any nystagmus or involuntary eye movement, so that's good. Now I'm going to do the accommodations test. Ask you to stare at the wall, and whenever I tell you to stare at my finger, look at my finger. So can you stare at the wall? Can you look at my finger? Wall, finger, wall, finger. Okay, so I saw that her pupils were reactive and they were dilating while I was doing that, so that's good. I'm gonna do the confrontations test, and this is to test her peripheral vision. So I'm just gonna ask you to look straight ahead and cover one eye. I'm gonna move my finger outwards, and you're gonna tell me whenever you can't see the finger, but don't follow the finger with your eyes. Okay, so I'm just gonna start. Can you see?
Mhm.
Can you still see it?
Mhm.
Okay. Can you cover the next eye? I'll start. Can you see my finger?
Mhm.
Okay. How about now?
Mhm.
Okay. So there's no peripheral vision loss. Now, okay, so now I'm just gonna shine this light into your eyes. This is to see your corneal light reflex. So if you could just look straight ahead. I'm just gonna shine this. Okay, it looks symmetrical. Now I'm going to do your pupillary light reflex to see if your pupils are reactive. So if you could just look straight ahead, and I'm just going to shine this in each eye. Okay, I saw the dilation. Next eye. Okay, good. So her pupils are round, reactive, they're symmetrical. So I'm just gonna have a look inside your eye now. So I'm just gonna put your bottom lid down. That's okay with you. Okay, I see that her conjunctiva is nice and pink. I don't see any masses, no discharge, no redness, no lumps. Pull your eyelids, your top eyelids up a little bit to check for any redness or lumps. Okay. Okay, so I see that they're nice and pink. I don't see any visible discharge, no masses, no redness, anything. That's good. Okay, so now I'm gonna do the Snellen's eye chart test. So I'm just gonna ask you to cover one eye for me, and whenever I point to a letter, if you see it, you say it. Okay? Let's start.
E, F, B, T, O, V, L, P, E, D, P, E, C, E, D.
Okay. So her vision for her right eye is 20/50, and what that means is that a person with perfect vision, 20/20 vision, can see this exact same line at 50 feet when you're at 20 feet. Okay, so let's do your left eye now. So cover your right. Okay, start.
E, F, P, T, O, C, L, P, E, D, P, E, C, F, D, E, D, A, C, F,
Okay, is 20/40, which means the same thing. A person with perfect vision can see this exact same line, or just generally see stuff at 40 feet when she could see it at 20. Now I'm just going to inspect your nose. So by just looking at your nose, I see that you don't have any visible lesions, bumps, lumps, or bruising. I see that it's also symmetric. So I'm just going to have a look inside of your nose. So if you could just tilt your head a little bit up and back. Thank you. So I'm just going to pull your nose a little bit up and shine this light in it to see. Okay, so I don't see any visible discharge. Her nasal turbinates look intact. I don't see any irritation, redness, lumps, bumps. That's good. Same goes over here. No irritation, no lumps, no bumps, no visible discharge. Nasal turbinates are intact. I don't see any nasal deviations or perforations, so that's good. Okay, so I'm gonna need you to press down on one of your nostrils and breathe through the other one. Can you breathe fine? You don't have trouble breathing?
No.
Okay, can you do it to the next one? Breathe. Okay, good. So now I'm gonna inspect her ears. So I'm just gonna look at them on the outside. So I'm just gonna shine this light to have a better view. So I'm seeing that there's even skin pigmentation. There's no visible discharge or lumps, bumps. Her ear shape looks normal. Everything looks good. No redness. So now I'm just gonna feel your ear, if that's okay with you. So I'm just gonna feel the auricle. Just tell me if it hurts or if you feel any pressure or pain. Do you feel any pain?
No.
Her lobule, do you feel any pain?
No.
And then her tragus, do you feel any pain or pressure?
No.
Okay. I didn't feel any tenderness, so her ears look good. I'm just gonna check the other ear. Same thing, even skin pigmentation, no visible discharge, no lumps or bumps, no redness. I'm just gonna feel her auricle now. Do you feel any pain?
No.
Now her lobule, do you feel any pain?
No.
Her tragus, any pain?
No.
Okay, it didn't feel tender or anything, no pain. Her ear shape also looks normal. So there's normal movement in her ear, as well as on this side. No tenderness, so everything's good. Okay, so now I'm gonna do the whisper voice test. So I'm gonna need you to cover one ear for me. And I'm gonna whisper something, and whatever you hear, just say it back to me.
1, 2, 3.
Okay, can you cover this ear now?
1, 2, 3.
Okay, good. Now I'm gonna do the bone conduction test with the tuning fork. So I'm just gonna hit this on the ledge, and I'm just gonna put it in the back of your ear right here, and you tell me if you hear it or not, okay? Okay. You hear it?
Yeah.
Okay, let's do the next ear. Can you hear it?
Yeah.
Okay, good. Now we're gonna do air conduction, which is the same thing. I'm gonna hit this, and I'm just gonna put it next to your ear, but in the air. Can you tell me if you hear it? Can you hear it?
Yeah.
Can you hear it?
Yeah.
Okay. So there's no hearing loss because she can hear it. Now I'm going to do the inspect her mouth and throat right now. Can you just open your mouth and stick out your tongue? Say ah. Okay. Her tongue is nice and pink. I don't see any lesions, any bumps. Her tonsils, I would grade them to be a 1+ because they're normal size, not enlarged. Her pharyngeal wall is also nice and pink, no irritation, redness, no white spots. Her hard and soft palate as well, no bumps, no lesions, nice and pink. Okay, can you smile for me? Show your teeth. Okay. Okay, her teeth look, they're not clenched. Now I'm gonna check your gums, so I'm just gonna put your lips down. Okay, her gums are nice and pink. I don't see any inflammation or irritation, redness, no bumps. I'm just gonna put your lips up. Okay, same thing. Gums are nice and pink, no irritation, redness. Okay, that's good. Okay, time please. Stick your tongue out. Okay, so her buccal mucosa is nice and pink and moist. I don't see any lesions or bumps. And this is to look on the sides of her tongue to see if she has any bumps, lesions, or bruising. So if you could just open your mouth and stick out your tongue. I'm just gonna grab your tongue. Okay, the side of her tongue looks nice and intact, no bumps, no bruising. Other side as well. I would also test her gag reflex by pressing down on her tongue with a tongue depressor. I'm just going to inspect your skin. Just by looking at her, I don't see that she has any suspicious warts that I should be concerned of. But if she did, I would note the color, the symmetry of the wart, location. Now I'm just going to use my pen light to, can I see your arm? How is that illuminating? Okay, I see that there's even skin pigmentation. There's no bruising, no rashes, irritation, no lesions. Can you turn your arm around? Okay, that's good. Can I see your nails? Okay. Her nail bed looks nice and pink, normal color, nice nails. So I'm just gonna test your capillary refill. Okay, capillary refill is good. So I'm just going to do your other side. Okay, same thing. Even pigmentation. No lesions, no bruises, no rash. Your nails, nice and pink color. Good. And your cap refill is good. Now I'm going to test the temperature of her skin, so I'm just going to... Okay, your skin is warm to touch, nice and moist, it doesn't feel dry, it's good. Test for the skin temperature, so I'm just going to put a little bit on your skin right here. Okay, that's good elasticity. Okay, so thank you for your time. We're done with the assessment. Have a nice day.